Welcome. This presentation will provide a brief overview of occupational therapy. So what is occupational therapy, or OT? The American Occupational Therapy Association defines OT as the therapeutic use of everyday life activities with individuals or groups for the purpose of enhancing or enabling participation in roles, habits, and routines in home, school, workplace, community, and other settings. What does this mean? What do OTs do anyway? Simply, OTs work with people to assist them to do the things they want or need to do. What are some areas that OTs address? We address play with children. Play is the most common occupation of children and the primary means of occupational therapy intervention with children. Play is how children learn about themselves and the world around them. Cognitively, creatively, social skills, communication, object manipulation, and gross motor skills develop through the multiple ways in which children play. We address instrumental activities of daily living, or IADLs. IADLs are things like cooking, doing laundry, and cleaning. IADLs are also things like paying bills, caring for children, and pet care. Everyone has some type of IADLs that they perform. I'm sure there are other things you do that fit into this category. OTs address activities of daily living, or ADLs. These are things like grooming, brushing your teeth, combing your hair, or washing your face, getting dressed, taking a bath, or going to the toilet. These tasks are all important occupations that people do in their lives. We also address occupations such as school education. Many OTs work in the school systems. And we address work. In fact, sometimes when we introduce ourselves to clients, they might say, "I already have a job," or "I'm retired, I don't need a job." We address many occupations, and as occupational therapists, we work in many settings. We work in hospitals and rehabilitation centers. We work in nursing homes, assisted living facilities, personal care homes, and senior centers. We work in school systems, and we work in outpatient clinics. We also work in home health settings and a variety of community settings. As you can see, occupational therapy has a very wide scope of practice with the occupations we address and the places we work. Some of the typical diagnoses we may treat are listed here, but this is not an all-inclusive list. Any person who does not have the ability to acquire an occupation or has a disruption in their occupations would benefit from OT. What is the educational and licensure to become an occupational therapist? Most occupational therapists have a master's degree from an accredited university. Some OTs have a bachelor's degree. The profession is in the process to move to an entry-level doctoral degree. There are also occupational therapy assistants. They have an associate's degree. Both OT and OTAs must pass the MBCOT competency examination before they can practice. States such as Louisiana also require the OT and OTA to obtain a licensure before they can practice. Future directions. This is the vision of where we want our profession to be. Our focus on health, well-being, and quality of life allows us as OTs to address the concerns and goals of our client. We address prevention and wellness. We do not just work with individuals, but we also address communities. There's so much more. We have some things to share during the IPE fair. The equipment or adaptive devices used are determined by the client's needs and abilities. We also provide environmental modifications that will allow the person to function in their environment. The OT evaluation and treatment is based on an occupational profile and the client's ability to perform tasks. We are client-centered. We want to know what goals are important to them. We consider the diagnosis and what are issues that may support or inhibit goal achievement. Using our clinical reasoning and working cooperatively with the client, we determine occupational-based interventions to meet the client's goals. Case study: 42-year-old white female admitted with symptoms of stroke. Occupational profile: roles, mother of two, wife, worker. We would evaluate what she wants and needs to do for each role, how she currently is performing those tasks, and what supports or impedes her performance. Without giving too much away, we would address ADLs, IADLs, and functional mobility related to the performance of ADLs or IADLs, and we would want to know her priorities. So we have covered what OT is. I just want to mention what OT is not. It is not just using cones, pegs, arm bikes. It is not just dealing with the upper extremities, splinting, or hands. Occupational therapy is a holistic, client-centered use of occupations to achieve the client's goals so they can live their life productively and successfully in their view. Thank you.